What you pay at different Cincinnati area hospitals can vary widely, even for the very same procedure.
That's what Local 12 troubleshooter Howard Ain found after investigating the hospital's stated fees, which were recently released by the federal government. Howard says knowing this information could save you money when you choose which hospital you want to use.
One hospital may have low fees for one procedure but charge higher amounts for another treatment. So I decided to find out if it really pays for you to shop around. Federal Medicare recently released area hospital fees for a variety of procedures. The differences are surprising. For instance, the posted charges for treating a major respiratory infection range from almost $29,000 at Jewish Hospital to $36,000 at Good Samaritan, about $39,000 at St. E's North, and more than $45,000 at Fort Hamilton Hughes Memorial Hospital. On a national level, the differences are even more significant. When it comes to the cost for knee or hip replacements, we found national hospital charges ranging from $5,300 in Ada, Oklahoma to $223,000 in Monterey Park, California. It's no different locally for these procedures. Hospital costs range from $45,500 at Mercy Franciscan Western Hills to $53,000 at St. E's North, $77,000 at Good Samaritan, and more than $92,000 at University Hospital. UC Health's Diana Lara says hospitals treat different populations, adding UC's hospital costs more in some cases because its patients are a lot sicker.
If your primary diagnosis was you needed knee surgery, but you also had heart disease and you also had diabetes, that's going to factor into your charges because we also have to treat those conditions as well.
Of course, insurance companies and Medicare negotiate to reduce these hospital fees. So although you can compare hospital costs, you have to be careful.
If you are looking to save costs on your procedure, it's always best to stay in network. But you would want to find out ahead of time what your network is willing to provide for you.
Greater Cincinnati Health Council CEO Craig Bramer says area hospital costs come in the middle compared with the rest of the nation. Some markets are higher, some lower.
In our community, we're fortunate that we have a very competitive health market. And so we have 5 adult systems in the greater Cincinnati region plus children's. And that's a pretty competitive, aggressive market.
Interestingly, studies show the quality of care delivered is generally the same no matter how much a hospital charges. There's no clear connection between higher prices and better outcomes. But it certainly is worth checking the listed prices before any kind of elective procedure. So we put a link to the Medicare list comparing the rates at local12.com. Howard Ain, Local 12 Troubleshooter.
From Local